So we made this presentation called The Choice by Felipe Oliveira.
Muhammad Luis.
Madison Gill.
Santiago Lucete. We chose candidate A. This woman, ages 41, and she's recovering alcoholic who has 14 months of sobriety. She also has a child. Our research question was, why would our candidate gain the most benefit out of the surgery? Looking at many factors, including the financial, social, and ethical side, we determined she will be the best fit. Some of the cons she has is, she has been a widow, she was an alcoholic, and some pros she has been recovering for over a year and is economically stable and wants to go back with her daughter to give her a better life.
The story of David. David Bennett received the heart of a pig instead of a regular human heart in his transplant surgery. This is because once the doctors found out about his condition, advanced heart failure and irregular heartbeat, they decided he was ineligible for a new human heart. His son also added that another reason he didn't get a normal human heart was because his father did not properly manage his health. It was later found out that David had stabbed a man in the 1980s, which further induced the debate on whether he deserved the heart or not.
Finance and future. Her company insurance, which paid for her rehab, will be important because they will be covering the cost of the transplant and post-surgery care. By helping with these expenses, the insurance will ease the financial burden on her. Heart transplant offers quicker recovery and fewer longer term costs. She had stable health after 14 months of sobriety. Average cost of that heart transplant was 1.6 mil, and she will pay almost 500K, in which she will be financed, and there are sponsors and financial aid that will help.
Okay, so with all the transplants, with all the surgeries, it's really hard because other than paying a bunch of money, her future is going to be really hanging there. And some people say the journey of a heart transplant only starts after the transplant, because in that moment there's a bunch of factors and a bunch of things that could happen. So there was a study shown about 150 persons, though that's why we only have the percentage, but it's from 18 to 59 years old, 26% past the age, 6 to 69, 29, and 70, 30. But what this shows is the mortality rate is really high. And in a heart transplant, some things that could happen is they could have irritation, or they could have a heart rejection or some other organs rejection. And some precautions they take is constantly follow-ups. There are constant C's and constant cares that the patient that did the heart transplant must go to. And there's also a bunch of therapy. So just like I said, there's a follow-up, but there's also this thing called cardiac rehab. So some of the patients, they're advised or instructed even to go and attend, because if they don't take proper precautions, they're gonna really get in trouble, and they can get an organ rejection without them even noticing. And so it's better to be caught earlier than late.
Shown us a study that people that had heart transplants over the 15 years, it showed that they're socially active, as most of them have either graduated from college or they have a life. They have kids. Some of them are even married, and a lot of them have health insurance.
An ethical view. David's story. Recapping on the story about David, it is seen that he had many reasons not to get the surgery in the first place. However, no one ever expected the ethical conundrum that was later found out after his operation had already taken place. Does a murderer deserve to live? Even if it was a while ago, would somebody else be more worthy of receiving the heart, although a pig's? Thinking about ethics and morality really have a big part when it comes to limited resources in a life-saving operation. Which goes back to why we chose the mother. In an infant observation, the conductor noticed that when the mother went to work away from her newborn, there were feelings of unbearable pain being harbored on both sides. It was difficult to watch the two being taken away from each other even for just a few hours. Hence, if this recovering alcoholic really wants to turn her life around and still has a young and impressionable enough child to do so, who's to stop her? Thank you.